Alright, so here we have the parasternal long axis view, and now we are going to see how to get to the parasternal short axis from this parasternal long axis view. This is going to be involving a rotationary motion of the probe, and we are now pointing towards the patient's right shoulder, and then to get to the parasternal short axis we are going to rotate the probe clockwise 90 degrees towards the patient's left shoulder. And as you can see, when you rotate it, we have the left ventricle in the short axis, and the right ventricle is right below the probe again anteriorly. So the image that we want to obtain for POCUS exam is having the left ventricle as rounded as possible at the mid-papillary level. We have the anterolateral papillary muscle here and the infroseptal papillary muscle here. And as you can see, we are comparing here the size of the right ventricle with the left ventricle. And in cases of right ventricular overload, the septum, which appears well rounded here, will appear flat. It can be flattened in diastole or in systole. If there is both diastolic and systolic flattening, giving to a D-shaped left ventricle, then that is going to be suggestive of volume and pressure overload of the right ventricle. At the same image, when we scan with a probe angle tilted, we are going to get different views. Here again, when you move the probe, like tilt the probe in the plane of the probe like this, it's going to be again causing a rocking motion of the image. You are scanning to the other side of the heart, but we are going to form new cross sections when you are scanning with the angle tilted towards differently. We'll go again to get the view of the parasternal short axis. I'm just changing the depth so that we get a good view, decreasing the depth to have just the heart in focus.
And
right
go back
there.
to full screen.
And we are going back to full screen. So now, when I tilt the probe with the tail going towards the right shoulder, which is like looking down towards the apex, we're going to look at the apex right there from the mid-papillary level. Whereas when I tilt it towards the upper portion with the probe tail going down, you see the mitral valve coming into the view right here. And when we do it furthermore, we look more anteriorly into the heart and have the aortic valve coming into the view right there. So for POCUS purposes, our main concern is to get a well-rounded mid-papillary level of the left ventricle, to look at the left ventricle, the right ventricle, and how each wall of the left ventricle is moving. Here we have the anteroseptal, the infroseptal, the inferior, the anterior walls, and the anterolateral and the infralateral walls. Here we can see that all walls are thickening, which means there is no regional wall motion abnormality during systole.